Dear viewers, Basic Facts on Respiratory System is a two-part series in Prescribon Medical Education series. Basic Facts on Respiratory System. This video is part 1 in the series. See related videos, two-part series on tobacco and three-part series on tobacco-related diseases in Prescribon Medical Education series. In this picture of respiratory system, you see the nose, mouth, pharynx, larynx, trachea, the bronchus, and the two lungs. Basic facts on respiratory system. The respiratory system functionally can be separated in two zones: conducting zones, that is nose to bronchioles, form a path for conduction of the inhaled gases, and respiratory zone, that is alveolar duct to alveoli, where the gas exchange takes place. You see the figure of respiratory system shown earlier. Anatomically, the respiratory tract is divided into upper respiratory tract, that is the organs outside thorax, nose, pharynx and larynx, and lower respiratory tract, organs within thorax, that is trachea, bronchi, bronchioles, alveolar duct and alveoli. Nose and nasal cavity are divided into two halves by the nasal septum. The pharynx is a tube-like passage that connects the posterior nasal and oral cavities to the larynx and esophagus. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. See figure respiratory system. Tracheobronchial tree. It is a complex system that transports gases from the trachea down to the acini, the gas exchange units of the lung. It is partitioned into 23 generations of dichotomous, that is dividing into two, branching, extending from trachea, that is generation 0, not yet divided, to the last order of terminal bronchioles, that is generation 0 divided into two 23 times. The bronchi continue to divide into smaller and smaller bronchi up to 23 generations, that is 23 times, of divisions from main bronchus. At each generation, each airway is being divided into two smaller daughter airways. The trachea, generally in midline position, about 12 centimeters long, is a hollow conduit for gases and bronchial secretions. Trachea divides into the right and left main bronchus. Bronchopulmonary segment. Bronchopulmonary segment may be defined as an area of distribution of any bronchus. Each lobar bronchi divides into segmental bronchi, that is tertiary bronchi, which supply the bronchopulmonary segment of each lobe. Respiratory function. Movement of inspired gas into and exhaled gas out of lung is called as ventilation. Lung volumes. Normal requirements of the body can be easily met by normal tidal ventilation, which is approximately 4 to 8 ml per kilogram. There is always some amount of air remaining in the alveoli, which prevents it from collapsing. This volume remaining in the lungs after vital capacity breath is called as residual volume. Gases remaining in the lungs at the end of expiration not only prevent alveolar collapse, but also it continues to oxygenate the pulmonary blood flowing through the capillaries during this time period. The portion of the air which reaches alveoli and takes part in the gas exchange is called as alveolar ventilation. Normal value of alveolar ventilation is approximately 5 liters per minute, which is similar to the volume of blood flowing through the lung. That is, cardiac output is also 5 liters per minute. Main functions of respiration. The main functions of respiration are to provide oxygen to the tissues and remove carbon dioxide. The four major components of respiration are the following. 1. Pulmonary ventilation, which means the inflow and outflow of air between the atmosphere and the lung alveoli. 2. Diffusion of oxygen and carbon dioxide between the alveoli and the blood. 3. Transport of oxygen and carbon dioxide in the blood and body fluids to and from the body's tissue cells. And 4. The regulation of ventilation and other facets of respiration. The low pressure, high flow circulation supplies venous blood from all parts of the body to the alveolar capillaries where oxygen is added and carbon dioxide is removed. The pulmonary artery, which receives blood from the right ventricle and its arterial branches, carry blood to the alveolar capillaries for gas exchange, and the pulmonary veins then return the blood to the left atrium to be pumped by the left ventricle through the systemic circulation. Pulmonary circulatory system. Pulmonary vessels. The pulmonary artery extends only 5 centimeters beyond the apex of the right ventricle and then divides into right and left main branches that supply blood to the two respective lungs. The pulmonary artery has a wall thickness 1/3 that of the aorta. The pulmonary arterial branches are short, and all the pulmonary arteries, even the smaller arteries and arterioles, have larger diameters than their counterpart of systemic arteries. This feature, combined with the fact that the vessels are thin and distensible, gives the pulmonary arterial tree a large compliance, averaging almost about 7 ml per millimeter mercury, which is similar to that of the entire systemic arterial tree. This large compliance allows the pulmonary arteries to accommodate the stroke volume output of the right ventricle. The pulmonary veins, like the pulmonary arteries, are also short. They immediately empty their effluent blood into the left atrium. Pressures in the right ventricle. The normal systolic pressure in the right ventricle averages about 25 millimeters mercury, and the diastolic pressure averages about 0 to 1 millimeter mercury, values that are only 1/5 those for the left ventricle. Pressures in the pulmonary artery. During systole, that is contraction of the ventricle, the pressure in the pulmonary artery is essentially equal to the pressure in the right ventricle. The systolic pulmonary arterial pressure normally averages about 25 millimeters. The diastolic pulmonary arterial pressure is about 8 millimeter, and the mean pulmonary arterial pressure is 15 millimeter. Pulmonary capillary pressure. The mean pulmonary capillary pressure is about 7 millimeter mercury. Left atrial and pulmonary venous pressures. The mean pressure in the left atrium and major pulmonary veins averages about 2 millimeters. Blood volumes in the lungs. The blood volume of the lungs is about 450 ml, about 9% of the total blood volume of the entire circulatory system. Approximately 70 ml of this pulmonary blood volume is in the pulmonary capillaries. The remainder is divided about equally between the pulmonary arteries and veins. Lungs serve as a blood reservoir. Under various physiological and pathological conditions, the quantity of blood in the lungs can vary from as little as half normal up to twice normal. For example, when a person blows out air so hard that high pressure is built up in the lungs, such as when blowing a trumpet. As much as 250 ml of blood can be expelled from the pulmonary circulatory system into the systemic circulation. Also, loss of blood from the systemic circulation by hemorrhage can be partly compensated by the automatic shift of blood from the lungs into the systemic vessels. Dear viewers, this is the end of part 1 in the two-part series on basic facts on respiratory system. For part 2 in this series, go to Prescribon Medical Education series, Basic Facts on Respiratory System.